Hello, I'm John Brisson, author of Fix Your Gut, health coach. Welcome to the Fix Your Gut YouTube channel. And today we're going to talk about a very important topic that I have suffered from off and on for years, luckily not any in the past 2 or 3 years, which is gastritis. Now, I had a poll in the Fix Your Gut Facebook page between do a video on gastritis and natural light, and it both came out 50-50, so I'll be doing a video on both. So let's talk about gastritis for a minute. Now, gastritis is the inflammation of the stomach lining, okay? So the stomach lining itself, the top layer is kind of like this gastric mucosa. It's a thick covering of mucus, like a mucosal barrier. And because, our stomach, it gets very acidic. The pH of it gets very low when we ingest food because our stomach produces a lot of hydrochloric acid. And we have to have this barrier, this mucosal barrier, which is full of this thick mixture of mucus and bicarbonate to protect the rest of the tissue in the stomach so that we don't get gastritis or ulcers, because if this mucosal barrier was not there, our stomach acid and digestive enzymes like pepsin would digest through the stomach, and you would have a perforation, and you'd end up getting infected, and you would die. So our stomach has this very thick mucosal barrier, as well as the epithelial cells of the stomach are very tight, which block gastric juice from being able to penetrate the underlying tissue layers. And our stomach is actually able to repair itself quite quickly within about 3 to 6 days, because the surface epithelium, or where the mucosal barrier, the top layer of the stomach, replaces itself about every 3 to 6 days. So there is, this mucosal barrier that is important to maintain proper health of the stomach and prevent conditions like gastritis and ulcers. So this mucosal barrier, however, it's not perfect. It can erode or break down, and you can start developing ulcerations or gastritis, which is inflammation. And when that happens, it can be very, very painful. Okay, so there are many different causes of gastritis that can cause stomach inflammation. Some can be acute, meaning you get over it in a matter of days, a week or two. Some can be chronic. Some people have suffered for gastritis for weeks, months, sadly years. And for a lot of people, there's many different causes. Usually acute gastritis comes from chronic alcohol consumption. Alcoholism can cause a very weak gastric mucosa from inflammation. The use of non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, which is Aleve, and aspirin, they can cause the body to not be able to accurately get the prostaglandins needed to maintain that mucosal barrier, so more inflammation occurs, and it can lead to gastritis or an ulcer, or even severe enough a perforation. Traumatic injury to the stomach, like if you ingested something that was very caustic, or if you've had a major intestinal surgery, if you had surgery on the stomach, cause inflammation or irritation. There are chronic causes of gastritis, and those include H. pylori dysbiosis, which I suffered from. And one of the main causes of gastritis is H. pylori, but other gram-negative bacteria can cause gastritis too as well, and so can the parasite Entamoeba hislica. So it's not always H. pylori, but when we talk about diagnosis of gastritis, we'll talk about how diagnosis of H. pylori is usually one way that a doctor may diagnose someone suffering from chronic gastritis. Bile reflux, because the stomach, though it has the mechanisms capable of handling stomach acid very well, it can't handle bile that's refluxed out of the duodenum through a weak pyloric sphincter into the stomach. Bile can be very caustic. The stomach can handle, it's used to handling a little bit of bile, but once it gets a large amount, it can start, causing issues with the mucosal barrier and start causing gastritis or ulcers to develop. And the same with if you get bile reflux into the esophagus, it's extremely caustic. It can start causing major epithelial changes that can lead to Barrett's esophagus. So Liver and kidney disease has also been implicated as a cause of gastritis. Stomach cancer. People with stomach cancer have gastritis. There's a condition called Zollinger-Ellison syndrome where there are tumors, gastrinomas, which are a neuroendocrine tumor, that secrete gastrin, and the tumors are usually found in the pancreas, the duodenum, the abdominal lymph nodes, but it can be found everywhere, but usually that's where they primarily are. They secrete a lot of gastrin, and the gastrin is one of the ways your stomach it causes your gastric glands to secrete more hydrogen ions, and when that happens through the hydrogen potassium pump, stomach acid is produced, hydrochloric acid is produced. So when you have these tumors, they produce too much gastrin. Therefore, the pH of your stomach becomes too low, which can happen, and in doing so, it causes erosion of that bicarbonate mucus that can't be replaced as much as, to neutralize the amount of acid that's in your stomach and how low your stomach pH is. So Zollinger-Ellison syndrome can be a cause of chronic gastritis, but usually in that condition, you also see other symptoms like chronic diarrhea, pain in your esophagus, nausea, wheezing, blood vomiting, malnourishment, loss of appetite. So yes, if your doctor's exhausted all causes of your chronic gastritis, like you test negative for H. pylori, you don't drink alcohol, you don't use NSAIDs, or you stopped using them, then there might be a possibility, rarely, that you could suffer from Zollinger-Ellison syndrome, and then more work would have to be done for the diagnosis of that. Maybe if they did a fasting gastrin level and it was elevated, or an endoscope to look down there to see if they see any the tumors, or if you have multiple ulcers or anything. But yes, Zollinger-Ellison syndrome is one of the last causes of gastritis. Now, there is one thing I want to talk about too, separately from that, which would be a dietary issue, is the brown seaweed extract carrageenan has also been implicated as a cause of gastritis, and it could also cause inflammation in the intestines. I mean, some people can worsen inflammatory bowel disease. So I would avoid carrageenan as a seaweed extract, brown seaweed extract. You'll see it a lot of, it's a thickener. You'll see it in to thicken a lot of cheap products together. Even some organic products can carry carrageenan too. So just be aware. I try to limit my ingestion of carrageenan as much as possible because it can inflame the intestinal tract. So if you're suffering from gastritis, you want to look on your food label and make sure there's no carrageenan. Carrageenan. And it's usually used to thicken up products. Like if you buy cheap sour cream, for example, it'll be in there, or canned whipped cream would have it in there as a thickener. I'm just trying to think of things that you'd use to thicken it up that could contain carrageenan. So what are the symptoms of gastritis? The symptoms of gastritis usually is some sort of burning or pain in the stomach. Now, the stomach is anatomically located next to the bottom of your sternum, which is your breastbone. To the left is where it generally is. Now, there is, I can't think of the name of the health condition, but there is a health condition where the organs are actually switched. But for most people, it should be right here. And you'll feel it in this general area. Your stomach may growl or make gnawing sounds more, especially when it's hungry. You may have more of a sense of fullness in your stomach. You may get full more easier. You may develop ulcers secondary from the gastritis. You may have indigestion. If you have upper gut dysbiosis like H. pylori, you may get bloating or belching. And finally, there is a form of anemia that's usually associated with gastritis known as pernicious anemia, which is pretty much, okay, so your stomach has an intrinsic factor that when you eat foods that are B12 or take a B12 supplement, the stomach has to mix this intrinsic factor in so that the B12 can later be metabolized by your body and absorbed. So a lot of people with gastritis, when your stomach's irritated or something else is going on, you don't really produce intrinsic factor as much or at all, and in doing so, B12 decreases, and you develop this pseudoanemia, pernicious anemia that's like B12. It's not caused by direct like iron deficiency or improper iron metabolism. It's actually caused from B12. Usually, one of the most common symptoms of that is if you're extremely tired all the time, and you're having gastritis, and you're having issues like walking to the mailbox, and you feel out of breath walking to the mailbox, more than likely it's pernicious anemia. My grandfather had it. I was able to correctly, guess that's what was going on with him, because he, against my better advice, decided to take a a proton pump inhibitor, and for about a month or month and a half, and his B12 decreased, and he actually started getting out of breath. So yeah, that's usually one other symptom I want to talk about, or a side effect of gastritis, should I say, is precocious anemia. So what are the diagnostic tests for gastritis? A doctor may do an x-ray to look at the stomach lining. They may do an endoscope to go down there and look, and I did a video previously on whether you should weigh the pros and cons of getting an endoscope procedure done, and the dangers associated and the risks associated with its use. So please, I'll link that video in the show notes and watch it if you do have gastritis and you're thinking about getting one done. And a doctor may, do an H. pylori test, and there's many different ones from that, ranging from when they do the endoscope, they may do a biopsy, to a stool antigen test, to a urea breath test. I recommend doing a urea breath test if you're going to a gastroenterologist and you're trying to determine H. pylori. They're not perfect by any means. You have to make sure that you're not supplementing with any type of like betaine HCl to decrease stomach pH, and doing so it would or any antimicrobials, because doing so it would lessen H. pylori's ability to produce urease and to produce ammonia. So yeah, I would, if you're going to get a test done by your doctor, and your three choices are stool antigen, four choices: stool antigen, blood antigen, urea breath test, or endoscope biopsy, I would try the urea breath test first. Maybe have them run a stool antigen at the same time. And then, they can also do a stomach biopsy through an endoscope if your gastritis are really trying to figure out what could be the causes of it. But usually those are the diagnostic tests that are done to determine about gastritis. So let's talk about how to get relief from gastritis if you are suffering from it. First, if you drink a lot of alcohol, you probably should reduce your alcohol consumption. That may knock it out right then if that's your problem. If you're using NSAIDs, then I would talk to your doctor about maybe reducing them, or using the supplement. If you have to use them, use a supplement, zinc carnosine, in combination with taking the NSAID. And that may help improve the strength of your mucosal barrier, and may reduce the gastritis. If you have H. pylori or any upper gut dysbiosis, it's best to reduce the upper gut dysbiosis that you're suffering from, and in doing so, this gastritis should reduce. But there are many supplements that I do recommend and do like people to try for their gastritis to see if it can improve the health of their stomach. One of them, like I mentioned a minute ago, is zinc carnosine. This supplement gave me immense relief. I love zinc carnosine. I still take it off and on to this day if I feel like I'm having any digestive discomfort. And it works very well. Zinc binds very rapidly with the stomach mucosa, and the reason why they included the amino acid L-carnosine in this is to slow down its rapid binding, because if you took a zinc supplement on empty stomach, for example, that's not zinc carnosine, it would cause immense stomach pain and nausea and vomiting, because it rapidly, it's a weak Lewis acid, it rapidly bonds to the stomach mucosa. It can cause a lot of irritation, a lot of gastrointestinal upset. That's why they switched the use of from zinc to make pennies to copper, because children were ingesting zinc pennies on occasion, and it was causing severe gastrointestinal distress, ulceration, and possibly even perforation. So that's one of them. Other than cost, that was one of the reasons why they switched from using zinc to copper. This is one recommendation. What it does, zinc carnosine, or zinc itself, is it improves that prostaglandin production that I mentioned earlier. That's very vital for the proper production of the mucosa itself that NSAIDs interfere with. It also reduces inflammation, but it helps the immune system in that general area too, and it seems to protect the gastric tissue itself as well. So there's one reason why I do recommend this. If you're going to try anything for gastritis, I'd recommend trying this first. Now, there are other supplements that I've used in the past that I recommend too. One being DGL licorice extract. DGL licorice also works very similar to the zinc carnosine in that it protects the mucosal tissue, it reduces inflammation, and it's been studied in Europe specifically for gastric ulcers and gastritis, and is given by prescription in Germany for said issues. So yes, DGL licorice extract works very well. You have to take it. Zinc carnosine you take with meals. DGL you have to take 30 minutes before a meal so that it can help coat your stomach, and you're supposed to mix it very well with your saliva. So I don't usually recommend capsules. I usually recommend chewables or a powder that you can swish around in your saliva, get it working, and then swallow it. But yeah, it seems to work very well. Another common supplement that's used for gastritis is aloe vera. Aloe vera can be very soothing to the stomach, and it can also help increase the mucus production and calm an overactive immune system. So yeah, George's aloe vera is the kind I recommend. Doesn't contain any anthraquinones, which are in common aloe vera supplements, which can cause diarrhea. So yeah, I like George's aloe vera. It kind of tastes a little bit like water. It doesn't really have a taste to it. And it looks like water too, but it does work. I've used it for my gastritis in the past, and I did find some relief. Some people do well with the supplement D-limonene, orange oil. Now, it can, for some, trigger gastritis, and for others, it could be the thing that reduces it. It does work very well against H. pylori. It does increase vasoactive intestinal peptide, and does help with the mucosal barrier. It helps reduce inflammation and everything. So yeah, if your gastritis isn't severe, I might recommend trying D-limonene too and seeing if that helps. Now, some people use L-glutamine. I necessarily don't have a problem with the use of L-glutamine, as long as you're not suffering from H. pylori or any type of upper gut dysbiosis. L-glutamine could cause more issues because there's bacteria able to metabolize L-glutamine, so it can making them more virulent. So I usually don't recommend that in case. But if your gastritis is caused by, let's say, NSAID use or alcoholism, then yeah, the use of L-glutamine is perfectly fine. Or if you ingested some medicine that irritated your stomach lining, or ingested something that would irritate it, then yes, the use of L-glutamine may be beneficial. About 4,000 to 8,000 milligrams a day to start out with. Of course, run any of these recommendations by your healthcare professional before you start them. Now, if it is severe, if your gastritis is severe enough, or if you have a large amount of ulcers or even a perforation, it may be needed to take an H2 antagonist or a proton pump inhibitor for a short period of time. Now, I usually recommend that you try an H2 antagonist first before a proton pump inhibitor, because they don't work. They're not as strongly they don't work as strong as their issues with inhibiting proper stomach acid production. H2 antagonists don't seem like Pepsid. Pepsid is the one I recommend. It doesn't seem to cause as much issues with B12 and magnesium depletion that a proton pump inhibitor would. But if you do need to use it, then I would recommend Pepsid for an H2 antagonist and Prilosec for a proton pump inhibitor. Bismuth may help too as well if we're talking about medications for gastritis, but it can irritate the stomach too. For some, it can work very well, especially if you have H. pylori, because it can inhibit H. pylori. So that's something that you may want to ask your healthcare professional about if using bismuth. I usually recommend Devron, which is bismuth subgalate, instead of Pepto-Bismol, which is bismuth subsalic acid. I don't really recommend subsalic acid in someone with gastritis or ulcers or anything like that, because it can increase bleeding, as well as some people may be sensitive to salicylic acid, salicylates, which, for example, if you ingested the Pepto-Bismol and give you a ring in the ears, you're probably sensitive to salicylates, so you would need to avoid it, and aspirin too. But yeah, those are medications. I know some doctors recommend sulfurcate, which is kind of like a sucrose aluminum compound. I usually don't recommend its use, even though aluminum is not really absorbed very well through the digestive tract. But in someone with gastritis, those gut junctions, especially within their stomach, aren't as strict as they probably should be, so you probably would absorb a little bit more of the aluminum than normal. So I usually don't recommend any medications with aluminum or usage. I just think there's better options. Two last things you could try if you're going a more herbal route is a mixture of slippery elm and marshmallow extract, which would just coat the stomach. It would give you more mucin down there, and it would help protect the stomach, the mucosal barrier. So yeah, if you want to go with the good marshmallow extract powder and slippery extract powder, just follow the general directions for them and just mix them together well with water and consume them about 15 to 30 minutes before a meal. That can help your stomach too as well. But yeah, I think we pretty much covered everything about gastritis, its many causes, ways that your healthcare professional may diagnose it, supplements that you can take, and even treatment options if severe enough for gastritis. Remember, the three main causes of gastritis is alcohol consumption, NSAID use, like aspirin or Aleve or Advil, or H. pylori dysbiosis. Usually, it's not caused. Most of the other causes, most of the time, those main three are the main causes of most gastritis. So yeah, I hope you find this video informative, and I hope it helps. If you do, please like and share, and please subscribe to the Fix Your Gut YouTube channel. I hope you all have a great day. Take care.